All right, everybody, welcome to the Bonner Breakdown. It is so good to be with you today. Today is episode number 25. I'm here with Erin Binnall and Dr. Stacey Good. And we are going to start off today's program saying thank you, of course, to Bonner Community Housing Agency, our sponsor, as well as Ting, who's done an awesome job helping us with getting this show off the ground. So we say thank you so much to those local partnerships that we're able to develop. And we want to say hello and welcome to Erin Binnall and Dr. Stacey Good. Hi, guys. Welcome to the program.
Thank you.
Thanks for having us.
Awesome. You know, I find it interesting that I have amazing Zoom call, no disruption in video or audio until I go live. And the minute I go live, so you might see my facial expression not move every once in a while we're on the podcast. Just know that I'm here, I'm listening. Even if you don't see my face moving, I'll try and fix that as soon as I can. So we start off every program with what we call the Good Report. And I am very interested in hearing from you, Dr. Good. What is your good report?
So as far as kind of my background, my history, or?
Well, no, let's just start off. Do you have anything super positive or a highlight that you would say, hey, this is a great thing that's been happening recently that you would want to just say, hey, this is something super positive going on?
Yeah, we have a total of 4 cases in Bonner County, and so the stay at home and flattening the curve has worked.
Yeah, come on.
No community spread, so that's what everyone has done has been effective, which is probably the best news that anyone could ask for right now.
Awesome. And how about for you, Erin? What do you got?
We live in Bonner County, total population of 44,727 people as of 2019, and an amazing, generous community, I might add. The outpour of support for all of us healthcare workers has been significant, and that's just really kept us going and kept us positive during, such unknown times.
Well, that's awesome. You know, I was looking at the recent shipment. My good report, just something I wanted to highlight, was the shipment of ventilators from Percussion Air down to Sacramento. And so I just thought that was great that Ader, or however you say that, Quest. Now it's hate. Do you know how to say it? Hater.
Nope.
I just saw it in the paper. I'm like, but they, shipping those ventilators down to that they built up here and then shipped down. I just thought that was great. What a good partnership for local business to be helping out in areas where it's needed. So it's really good. So Erin, I originally had wanted you to come on back with Justin, and Justin's been on the show. And he had a good report as well. So we always just say cheers to the good report. Awesome. Cheers, Ting. Let's give it a little thing there. I know you guys would have to pull masks down to take the sip, but it always feels good to do a cheers every once in a while. And we like doing it when it's a good, positive thing. And 4 cases in Bonner County is kind of mind blowing to me. You know, especially when you look just south of us, they've had a lot of cases, in Kootenai County. And so what a great positive report. So let's transition from the good report into kind of more of the actual meat of the show here. So Erin, can you tell us a little bit about yourself and background and history here with Bonner General?
Sure. I began working in the community development department in January of 2017. Community-based healthcare is really important, especially in rural healthcare communities. My role, I oversee marketing, communications, community development, so outreach and partnerships within our community, and then also work with our foundation, which raises money specific to Bonner General Health. My main focus is on our health disparities that's identified through our community health needs assessment, and then implementing programs, identifying resources that can really make a true impact here in Bonner.
That's great. Yeah, that's great. Now, where were you originally from? You came here in 2017. Were you already living here when you started working for Bonner General?
I did, yes.
Okay.
I worked for Kinixu Health Services for about
Okay.
12 years, which is another wonderful healthcare entity in our community.
Mm-hmm.
And before that, I worked for a nonprofit hospital an hour south of Chicago.
Okay.
Um, yeah, so I've really grown up in healthcare since I was a kid.
No, that's wonderful. That's wonderful. So since you came on with Bonner General, what's been some big changes that you've seen at the hospital? Not just the recent, obviously, but
Mhm.
what's been some of the big transitions? Because it seems like it's been growing pretty rapidly.
Well, we've enhanced services. We opened up ear, nose, and throat. We will be opening up an ophthalmology clinic. But I think what's most important in my perspective that has been a change is we've been a true um, partner instead of just writing checks of sponsorship. We're actually in the community implementing programs. I've worked really hard with community partners implementing a suicide prevention program
Oh, that's
over the
great.
last 3 years, which is near and dear to my heart. And that's been really successful. It's disseminated throughout the entire sixth grade at Lake Pend School District. I've
Oh, good.
been teaching classes at LPO High School, which has been incredible. Those kids
Oh,
are
that's great.
amazing. And
Yeah.
unfortunately, my last class got cut short.
Uh-huh.
But I think being, really the health hub of healthcare and the true foundation for our community has evolved and
Yeah.
improved in the last few years.
Oh, that's really good. And what a dramatic shift that I've noticed just even in adding the new building several years ago, expanding a lot of the services. Things has been really good, especially in a small community, to have that many services available right here has been really, really wonderful.
Yeah, I
Um,
think the level of care that we provide within our hospital speaks volumes, and that's what makes it really easy for my role as
mm-hmm.
working in the foundation to get donations and
Uh-huh.
supporters, but also to be out promoting who we are, because it's really and when I say care from caring for your hospital room, our environmental services, our lab,
Right.
our ED, our dietary, like the whole care perspective.
That's so good. My wife and I had our daughter. It's almost 8 years ago here, and it was one of the most. It was such a pleasant, wonderful experience. The entire everybody was amazing, and I've never heard a bad report for anybody who's had any major needs and gone to Bonner General, especially recently. It's been amazing. So. You guys are doing a great job there. Well, I want to introduce Dr. Stacey Good. Stacey, how are you doing today?
Good. It's beautiful outside, so can't complain.
It's really nice. It's really nice. And I read your bio. Is pretty amazing experience that you have. Tell us a little bit about yourself and what you're doing up here in beautiful North Idaho.
Yeah, originally from Wisconsin, go Pack Go. And went to college, played Division I soccer in Wisconsin, and then um, went to med school, yeah, out in the Midwest, and then ended up on an Army scholarship out in Tacoma at Joint Base Lewis McChord.
Uh-huh.
So did my emergency medicine training out there, met my
Uh-huh.
husband. Told
Cool.
myself I wouldn't marry another doctor and I wouldn't marry someone in the military and I wouldn't take his last name, and all those things came true. And then I did a emergency ultrasound fellowship out there, and the Army took us down to El Paso, Texas, and through a convoluted number of events, we ended up back here. One of our good friends, their parents own a marina in Bayview, which is kind of what introduced us to the area.
Okay.
And my husband met an ER doc in the middle of nowhere, Afghanistan, who was one of the
Wow.
founding members of the Lake Pond Area Emergency Medicine Group. So
Oh, that's cool.
we've been out here about 3.5 years
Wow.
and have 2 little boys, and both husband and I are ER docs, and we're loving every part of it.
That's awesome. And I'm so glad that you guys, for whatever reason, found your way up here. I'm always amazed at where people come from and land in this beautiful area. I mean, we know that the landscape is gorgeous. The lake is amazing. The mountains are great. And it just does something to people when they get up here that they go, oh, I think I want to stay, and that's great. Cause I'm sure that you and your husband could probably pick a lot of different places to go, but you chose to come to Sandpoint. So we're glad you're here. Thank you for coming.
Yeah, we love the mountains, we love the lake, but we also really were interested in a small town feel. And Sandpoint has kind of all those things to offer. And then becoming, working with the hospital, it's kind of come to, I guess, full circle as kind of why we're here. So
Right. And so you and your husband both work in the ER. And before COVID-19 hit, what was kind of your pace? Was it always super busy in the ER, or was it just kind of, kind of a mellow pace?
It's a good question. I would preempt that with what I thought was going to be kind of rural emergency medicine before moving here, and what actually was. It's busy.
Okay.
There are a lot of sick people that don't come in until they're really sick. A lot of people that work really hard in blue-collar jobs that don't want to come in until their arm is so broken that they can't work anymore. And we do it's a smaller ER, so the logistics of the ER make it seem a little bit busier than it is at times, but it's a busy place, and it's single coverage. Also in the summertime with the tourists and kind of the snowbird population, our census in the ER goes up dramatically, and it becomes very busy.
Yeah.
You never know what you're going to get when you come into a shift.
I bet. The challenge, for us here is that our population triples, in the summer. It goes from 40 some thousand to 120,000 for 3.5 months. It's a pretty wild dynamic to have. And I think, that obviously stresses the infrastructure of the hospital and the ER and everything else that's, not necessarily built for 120,000 people here. So yeah, it's pretty wild, pretty big seasonal difference.
Yeah, big seasonal difference, especially in musculoskeletal injuries in the summertime. Fortunately, we have a great relationship with Kootenai. So especially trauma, accidents that happen on the water, accidents that involve alcohol. We have, good relationship with them. And we also we only have one doctor working at a time, but we have a pretty tight-knit group of partners that if it does get overwhelmed, there's almost always someone available to come in and help, which is a pretty unique situation.
Oh, that's great. That's great. Well, we're in the middle of a global slowing down of everything with the stay-at-home order, where we know that Governor Little said, hey, we want everybody to stay at home. I know Bonner General began preparing right away with an exterior tent and some other things for people who might be infected with COVID-19. Can you guys give us just a basic update on kind of what that process was like when everything kind of started, how the ball got rolling, and then kind of the steps that you guys originally took, and then kind of how that's played out since?
Well, February 27th, the CDC put out the recommendation for all healthcares to initiate incident command. Bonner General Health did that immediately. So on February 27th, we started meeting weekly at that point, because at that point there were no known cases in the United States, theoretically.
Right.
And so since then, we we met once a week. That lasted for 2 weeks, barely, and taking a look at, okay, what do we need to do in order to, protect the well-being and health of our staff, our patients, our community members. And once we started meeting, we realized we needed to start meeting weekly. We did soft visitor closures to start off with. We then eliminated or put on hold all of our elective surgeries.
Okay.
We condensed all of our specialty care. So specific to our ear, nose, and throat right now is not seeing patients. We postponed the opening of our ophthalmology clinic.
Okay.
Any of our performance therapy services, Sandpoint Women's Health, those services,
Wow.
it's very limited.
Yeah. Wow.
So, I think it's important too that people realize that healthcare industries have taken a huge hit drastically too. 80% of our revenue is generated by our outpatient services. And so we, as much as anybody, want to get things back and going, but unfortunately we also really know the importance of this stay at home until it needs to be stay at home and it's safe, and really relying on CDC and Panhandle Health guidelines to open that back up. So we're continuing to review that and evaluate that. We meet every morning at 9:00 via phone. So we have a conference line. We're not face-to-face right now. And kind of checking in to see where we're at, where the numbers at. Testing, I really do want to give a shout out to our lab. It's Lab Week right now. And we were the first North Idaho hospital in the Panhandle to do rapid testing. That it hit off before any of our other Region 1 hospitals. So I'm incredibly proud of them. And
that's
they're
awesome.
Working on our validating for antibody testing, the IgG testing, which is also significant. So I'm that's kind of on the administrative side perspective. I'll let Stacey speak to the medical.
That'd be great.
Probably around the same time, I would say early March, there's a group of, there's 7 of us kind of in the group of emergency medicine doctors. And we sat down and said, hey, what do we need to do? Because if this hits here, in the current situation we're in trouble. And so we met daily, I think, for a week, and then it was kind of every other day, going over, different people having different jobs, how we're going to do the testing, how we're going to change the logistics of the emergency department. So we have negative pressure rooms, we have rooms that we can wall off. With sick people. How do we get ambulances into these rooms, and how do we keep the people that need to be in there for other things safe from those potentially sick people? So that kind of started steamrolling all these different kind of avenues and paths to make the ER more functional, which is also kind of when a second tent went up in front of the ER, and we have a decontamination trailer for all of our PPE, and then that also instigated the donning and doffing protocols and making sure all of our nurses and providers in the hospital knew how to do that and do it accurately. I mean, you can see that in Idaho, over 200 healthcare workers have been infected. So we didn't take that lightly, knowing that, I mean, in our ER group, we have 7 docs, 2 of which come from the same family. So I feel personally invested that we need to be doing this right. So anyway, so incident command and the hospital really kind of took a lot of our recommendations and concerns to heart. And I think that started a really good communication pathway with us.
Oh, that's good.
Admin. And now I think we're at the point where if we do get busy and we do get a lot of cases, then we're going to be a heck of a lot more prepared than we were a month ago. So as far as, the testing early on, and I kind of want to speak to the 4 cases that we have in the Panhandle. Early on, we had very low tests, just like everyone, and we were turning people away left and right that were very bad symptoms, not sick enough they need to be at a hospital, but we were unable to swab them because we had to save those few tests for patients that we were admitting. So yes, we only had 4 cases and have 4 cases, but there were patients that me and my husband even saw in January and February that had this pneumonia that was different than anything we'd seen, that didn't look bacterial on x-ray. And looking back, like, it was here. And we just didn't know what it was back then.
Yeah,
So
I agree with you in that it was likely here. I'm very interested in the antibody testing because it'll be very good to know, like, how many of us actually already had it. You know, my wife and I traveled to Ohio in the beginning of February, and we went through Seattle, and this is right after. This is when, 40,000 Americans are being repatriated from China, from Trump closing the border down at the end of January. So there's this slew. So Seattle's a major port there. And so we're going through there. We were super nervous, keeping our distance. And we go to Ohio, come back. Come through Seattle. It was a super long day. We come back and I just got sicker with the sickest thing that I've experienced in a long time with my chest and, stuff for that whole following week, a little, like, almost 10 days,
Yep.
So it was like, and look, now we're like, oh, well, maybe that was, like, we don't know. So I think it's interesting that you're saying, hey, we probably already have had some of this stuff going around.
Yeah, and speaking to the antibody tests, it'll be a game changer when we get it. I mean, especially for us as healthcare workers, I want to see if I was either A, exposed, or B, at a mild case, because I know I'm at high risk to be a vector. And for how long am I going to be isolated? I mean, this isn't going to end anytime soon. We can talk about that down the road, but
Yeah, we'll get there for sure. Yeah. Go ahead, Erin.
No, I agree with everything that you guys are saying. I think antibody is going to be a game changer for us, and it'll help answer a lot of our community's questions. They're curious.
Yeah, and it's to me, I feel like it's very easy to get lost in the information. There is so much varying and countering, it seems like, at least, information out there about what's happening, what's not happening, what reality is. So when you look at, where we are at today, we've had 4 cases. Were any of those 4 hospitalized?
Yep.
Yeah.
Okay. So,
and I can say to one of them, did not have the social distancing. It would be all over our community. A very active individual, family person. So, yep.
Okay. So the effect essentially is that social distancing has had the positive impact that we were hoping for by everybody kind of staying low, and that we haven't had a huge number of cases here.
Yeah,
right?
Correct.
Yeah. So when we look at the current situation where we're at now, obviously we're still at a stay-at-home order here, and we'll see what ends up happening at the end of the week or beginning of next week, with this kind of this concept of reopening America a little bit. I know the governor's talked a little bit about kind of what he'd like to see happen and where he thinks we're at. What do you see for where we're at right now?
Yeah, so this is, of course, my opinion. I think we've done a great job at flattening the curve. We are not going to eradicate this disease.
Right.
However, I think that we have done everything we can do in the community to keep these cases at bay. Because you look at it and you're like, when someone's first exposed, you've got at least 2 weeks incubation, maybe even more before they start having symptoms. So now we've essentially gone through a month of not having a lot of cases. So we've done a good job. We are now at the point where we can handle more. An outbreak is still gonna, quite honestly, destroy us. But the reality is there's also a tipping point where we have to open things back up, and we can't shut things down indefinitely because the the cost to people in our economy is going to be as severe. So I think we are very close to opening things up. And I think that when we do it, it has to be done in a stepwise manner. It's not going to be all for nothing, like we're just going to just let everything go.
Right.
I think it has to be done very carefully. That being said, we haven't had the tourism here that we're going to get in the summer. And
That's right.
I personally expect that we are going to get an upswell of cases in the second half of the summer. My estimate would be after the 4th of July, we're going to start getting more and more cases here. And the whole point of flattening the curve was not to eradicate it. It was to allow the healthcare system to catch up when we do have an increase in cases.
Right.
And between Region 1 and all the hospitals around here, there's a good plan in place for that surge of patients. And I personally feel more prepared for it. I still am very anxious about it and will be. Because until we get a vaccine, this is still going to be an issue. And the other part of that, Chris, is that this hasn't really been talked about. We're the second most unvaccinated county in the country. So even when we get a vaccine, who's going to get it? And so that puts us in the healthcare industry, like in a hard spot. So, and it's going to put us in a unique situation up here. So, there's a lot within that. But kind of the short answer is I think that we need to start opening things up, and we're not going to stop tourism. We're not going to stop snowbirds coming. We just have to be really smart in how we go about doing it.
Yeah, it was interesting on Friday last week. I saw more Washington plates than I had seen in months around town. I work right downtown, and I saw 2 people, busting through stop signs, like these people who just I'm like, oh, you have not been here, like you are from out of town. I was like,
but our economy relies on that too.
It totally does.
So we need them here to an extent, and closing like state parks and stuff in other states, it's just going to bring them here. So it's not necessarily a good thing for us.
We're geographically closer to Portland and Seattle than we are to Boise.
Yep.
And I think people forget that. Like, we're actually physically closer. And I think, Portland just shut down all of its parks, all of its outdoor recreation, everything across the board. Like, if you're a mountain biker and you live near Portland, you can't go anywhere near Portland to mountain bike. Right. So I just feel like some of this stuff is definitely going to be pushing people our direction at a pretty high level. There's my awesome frozen face again for you guys. You love that. One of the
I think it's something to remember is it's really increasing depression and anxiety and those mental health issues. And
right.
Most states and in our country, it's a national issue anyway. And in our community, we're already at capacity for behavioral health services.
Right.
Our mental health therapists we saw a spike just in our behavioral health services over the last month since March 16th of a 17%.
Wow.
And, and we're providing that on telehealth, and that's,
we've seen ER patients.
Right.
We have 4 of them in the ER. So.
Can you say that again? I didn't quite hear that.
We've seen an increase in mental health patients in the ER.
Okay.
Suicidal ideations, attempts.
Wow. So let's talk a little bit about something that you said, Stacey, was that we can't prevent this from spreading in the sense of long term. Like, we flattened the curve, but we're going to have to deal with this here locally. Obviously we want it to be as minimized as possible, but people are going to have to get back to work. They're going to have to do that. You talked about the incremental steps. I read through the, kind of all the proposals that have been out there from the White House and different things as far as what they're proposing in their phases of reopening. What are some things that all of us should keep in mind when we look at this reopening process and personal responsibility? What are some things you could maybe speak to about that?
So I think continuing to wear masks in the public, I'm seeing that in some places, not in others. I don't like to do it. So that's one easy one. Staying in smaller groups. I mean, that's pretty self-explanatory
Right.
there. And I guess as far as our businesses, probably going to have to limit like how many people are in a store at a time. Restaurants, I think a good answer is, roping off every other booth, roping off some of the parking and putting outdoor seating.
Right.
Those things will help kind of keep people distanced, but still within a community setting. The hard ones are going to be churches. The hard ones are going to be the salons. I think there are ways to do that are going to be creative, and I think there's already people working on those things. But those are kind of the big things that I think of. And from the ER, part of the reason we have that tent sitting out there is that we were just talking about the influx in the summer. We get a lot of lacerations, broken bones, injuries. So if we can, part of one of those tents we want to have is like an outdoor ER, essentially, where those sort of patients don't have to be in the ER, where they're at a little higher risk, because we all know that COVID can sit around in an environment for a long time. So if we can take care of those people out in an open air area, then it's going to decrease their risk of being exposed and transmitting the virus in the emergency room setting.
That's great. Okay. Well, I wonder also, about, you mentioned wearing masks in public, and you said, I don't really like to do it either, but it's something that we need to do. Where I guess, cloth masks, any type of mask, whatever is going to be more beneficial than not. Is that because it used to be don't do masks, masks, and I don't know if that was just a supply issue. It seems like there's been some back and forth about what that's supposed to be. But it seems like where we're at today, I'm not a big fan of trying to rewrite history and what we knew when and how we knew it, because that just never it never ends well when we try to go back and figure that out, because there'll be a time for that down the road. But right now, like, let's focus on what we need to do. So you think wearing masks is a primary thing, maintaining social distancing, personally, as far as what individuals can do. What about when we talk about recreation and hitting the trails, getting outside, getting on the lake? In some states, that's completely banned. So, being that we're such an outdoor state, have you heard anything about negative impacts of being outdoors and doing that kind of stuff?
I don't. That's my short answer. I think we need to be on the lake. We need to be on trails. What Erin just said, as far as mental health, that is so, it's so huge, and the risk is going to be smaller there than anywhere else. So yeah, get out on the lake, get your boats out. I personally don't think that those things should be closed, and especially in our community. I mean, I can't imagine going through a summer and not being able to be out on Ponderay.
And just in mind the smaller groups, and that we can still do all those things in social distance, and that's going to be really important.
I think the biggest thing to take away is my fear is that there are people that are going to think, let's just lift everything's going to go back to normal. I don't think anything will ever be normal after this. Yeah. And I think the healthcare industry is going to be different after this. And I also think our society and community will be different. That doesn't mean it has to be negative. Right. It's just going to be, it's going to have to be.
Yep. Well, I get really excited when, as a region or as a country, we face certain types of challenges, because usually the best ideas come to the top. The best innovations start to happen. You see technology shift. You see things move in a way that actually makes our lives better because of the tension around this. I could see there being some massive innovations happening in the healthcare world that allow for the safety and continued growth and continued allowing services and some of that stuff, because it's going to have to be different. Right. So hopefully we're open to some change. instead of just saying, no, this is the way we do it. It's always got to be this way. Do you see any big changes like that coming around the corner for you guys there at Bonner Health? Just kind of waiting to see what happens?
Yeah, I think right now, Chris, we're in the middle of this.
Yeah.
And it's hard to kind of think outside of that because it's so taxing. I can't speak for Erin, but it seems like it's kind of that's what we're in the middle of.
Yeah, I think that for all of us, every day where my day was focused on community, which it still is, but now it's COVID-19 in the community. Getting that education out there, working with our partners regionally, making sure we're all working together and all on the same page, giving out the same message.
Yep.
But I did, how many swabs we have, how many tests, and making sure that we're continuing to communicate, just like you said in the beginning of this podcast. I send out a email Monday through Friday of where we're at test-wise. Our community providers have been incredible in support and communication. We have an ethics committee, a patient plan committee, a patient placement committee. We have community physicians on some of those committees. We have some ED doctor on some of those committees so that we also have phase 1, 2, and 3 if there's a surge. So, we're just rolling with what we got, really.
Right. Yeah. When you look at the needs that you guys have there at Bonner General, you look at what is the community doing, and how can the community support Bonner General Health in this season?
I think supplies are always good. We're that's again a shortage. We've had an outpour of masks, gowns, hats, cloth masks have been significant. Our dental provider community has provided so many gloves and disposable gowns, all of those things. We're having to really strategically plan on, our different phases too, with shutting down a lot of services. It's hit us significantly hard. And most importantly, remember social distancing, the stay-at-home order, respect that. We have until April 30th. If we continue to do a good job, we can enter in phase 1 and phase 2 and opening back up. And also be kind to yourself. Be kind to our children when, they're going through so much right now. I have a 5th grader that is at home with 2 full-time working parents, and, be kind to our kids. It's a lot for all of us right now. So utilize that outside time to take care of yourself.
Yeah, and I would say 2 things in regard to that. So the PPE, one of the questions we get is, how big is your supply of PPE? And it's a really hard question to answer because if we get a surge, we're going to be out of it very quickly. Like right now, we're in a good place, but we're using N95 masks 5 times for 12-hour shifts, storing them in paper bags and rotating them on days we work in expectation for that surge. So we're always still in need of those things. And I've been super impressed by the community outpouring support in that. And kind of another thing that our community is doing is we're having restaurants just show up with 20 pizzas for the hospital and dinner from Arlo's, Uptown Bagel. And that doesn't seem like much, but for our ancillary staff, our nurses, our custodians, our housekeepers, I mean, it really boosts morale. And when you're sitting these terrible masks for 12 straight hours, like having a nice takeout meal is a big deal. So all those things have been super impressive. And kind of in secondly, what Erin was saying about families is we're in the front line of this, so we see it directly. And I can understand families that are at home that aren't in the hospital, aren't in the medical field, that can start, like, everybody's getting antsy. start wondering, is this real? There's thoughts out there. Is this a hoax? I think one thing to just remember with everyone is to give each other some grace. I have a great neighborhood where there's like 6 families and everybody comes from different social situations, different families. And one thing that I've learned in this is, yeah, my job's hard right now, but other people are going through their own hardships. And just because you have one thing that's going on doesn't mean someone else doesn't have something that's equally as tough but different.
Sure.
And we just all need to come together as a community, and you can read anything you want in the paper. It's if you want it to align with your opinion. And so that's another hard part about all this. So there's so much information out there. And the statistics are hard, and they're really easy to jade. I mean, we had months in med school and residency just to learn how to read a research paper. So they're easily skewed, and the people just need to be really cognizant of those things and really kind of filter through numbers and what they read.
Yeah, I really agree with you wholeheartedly surrounding the concept of extending grace to one another. There is this really difficult place where our lack of understanding and our lack of knowledge and knowing what's happening and where things are really at, because there is a competition for who's going to be most afraid and what we're going to be most afraid of in this whole thing. Like every side is coming out with fear mongering to the hilt. So it's like, in the middle of that, we just need to have grace toward one another and just know, hey, wherever we're at, we're in it together, and we need to just be extra kind, and allow kindness to really be our default setting, hopefully, in this season, while we're adjusting to a new normal, and it's going to be difficult. So, Erin, any thoughts on that? Needs at the hospital?
I think I shared what we need, and thank our community for their continued support.
Yeah.
We see a lot of different thoughts and different perspectives, but I think, as I mentioned, our population is over 44,000 people, and, right around 1,000 might be against it, but, we really appreciate the majority.
Yeah. Yeah. I think that there's if there's more opportunities coming up, if there's specific needs that the hospital has, how do you get that information out? Where can people go to find, information about what the needs are, if you guys have specific things that you're looking for?
Our website is a great resource. We have a specific list of supplies that we're always looking for and needing.
Okay, and that's in the show notes below.
Correct. Okay, so. And then follow us on Facebook. We are putting out lots of information. Dr. Good and Dr. Ben Good have done several radio shows.
I saw that.
As Dr. Hurt. Our lab has done some radios. They'll do a walkthrough of what the testing looks like. We're posting those videos.
Awesome.
They're informational. It's good to know. It's good to know what your community hospital is doing for you.
Good. Any last thoughts as we kind of wrap up today on COVID-19 outlook, what to expect, anything like that? We've already talked about a bunch, so.
Just remember, if you're still in need of services and you have an emergency, you're not feeling good, you have tightness in your chest, you have a cold, we still have Bonner General Immediate Care. And we also still have our emergency room department to see you for your emergency needs.
Okay.
Yeah, good. And I would say kind of that we tried really early to communicate with the public and the community about what we were doing, and being transparent and having that open communication, I think, is really important because kind of what Erin just said, there are people that are going to think differently, but I think us showing what we're doing in the lab, our plans moving forward, and just, like I said, being really transparent about that, I think is really important to keep the community kind of on board with what we're doing and keep us all on the same page.
That's good. That's good. Well, I want to say thank you guys for coming on the show with me today. Informative, helpful information, and hopefully people, if you watch this, follow Instagram, Facebook links are in the show notes below, as well as the bonnergeneral.org website. So Erin, thank you. It's nice to chat with you today, and Dr. Good, always a pleasure to meet you and good to talk to you. So, gals, have a great day.
Thanks. You as well.
All right. Talk to you later.
Bye.
Okay. Thank you for watching this episode of the Bonner Breakdown. Special thanks to Ting and BCHA for sponsoring this show. For more shows or to be a guest, please visit bonnerbreakdown.com. Have a great day.